Sanbonani, welcome to my channel. This is Mazina and I'm Maz, and today I will be talking about two streams of work for nurses. This is infection control and quality assurance or quality management. And quality managers ensure that quality in the service or in the care of patients is maintained. They do follow up on complaints, they do audits, they basically just maintain the standard of care and ensure that the protocols that have been put in place are obviously followed in order to maintain a certain standard. Now, there are some, actually all management courses that you do on a postgraduate basis. Well, some of them are undergrad basis, have quality management as part of the modules that they do. Now, how much do quality managers get paid? This was the very, very interesting part, guys. Like, abantu bayahola emnyango, hayibo bayibulala imali. Okay, quality managers in South Africa, according to the Department of Health, South Africa, the highest that a person can get paid is 553,000 per annum. Yay! 553,000 per annum. Yo! I nearly fainted when I saw this. Anyway, you would obviously can work in a hospital setting, or you can work in a private clinic setting, or any organization that deals with health and the health sector. And obviously, part of your job description, like I said, would be to ensure that the quality of healthcare is managed. Now, I'm on the Western Cape Jobs website, and the Department of Health Quality Assurance advertisements that is from 2020. That's the only one I could find. I'm just going to read what some of the responsibilities are. So it is to formulate quality assurance policies and strategies, provide expert guidance and support for implementation, effective coordination, control, monitoring and evaluation of quality improvement, risk management, occupational health and safety, and infection prevention and control. Now, people, no wonder they get paid. Is to support the health establishment, staff and executive management with the implementation of the ideal health establishment realization, that is the ideal hospital realization and maintenance, and Office of Health Standards compliance. Now, you will hear this OHSC a lot if you are doing quality management. Previously, we had the national core standards that we used to abide by, and then they were audited every year. Each hospital would go to another hospital and they're audited and things like that, and they check for the domains, things like cleanliness, safety, attitude of the staff and all of that. Yeah. Then we have coordinate interventions aimed at improvement of patient experience of care, customer, consumer quality and staff knowledge, effective leadership, implementation and management of the quality assurance program, perform any other delegated duties, including the establishment and maintenance of functional quality assurance committees in the substructure. Now, guys, equality management ibalulekile ngale ndlela. This is the person who identifies the gaps in the care that we are giving to the community through many research avenues, through monitoring patient surveys, through monitoring complaints, through monitoring patient safety incidents, through many avenues of gaining the information. Now, they sit down, they look at this information and formulate it and analyze it and make it into a representable data that can be read by everybody else to show you the trends, whether we are doing good or bad, which areas are we lacking on, and things like that. And that way, They can then implement quality improvement plans. I'm sure you've heard your managers talking about QIPs. Quality improvement plans are things that we identify the deficits, then we look at ways to improve on those deficits, and then you monitor whether you are actually improving in those areas. This is so that we have a reduction in patient safety incidences or a identified clinical risks so that they can be fixed. We reduce complaints from the public and the customers, and obviously we just maintain the way that the health establishment or the health department is perceived by the public, and ensuring that we actually care for how we are doing the work, not just that the work is done. Yes, the work must be done, but it also must be done in a way that prevents harm and promotes healthiness to the patient. Now, one such place where I found that this, for people who didn't do quality as part of their degree or diploma, it can be done through obviously the online universities and colleges. But like I said, it was very hard for me to find information on where these courses are actually being offered. So if anybody has any information for us, please feel free to get into the comments and give us a link or a phone number or something or anything that will help us to know where we can do the quality assurance certificate for the nurses. Please, guys, I'm begging you, we are in need of this kind of qualification. And I'm sure most of the time people are promoted into these positions, but obviously even them, they want to go and do a quality assurance course so that they can refresh their knowledge and just stay up to date with the way things are done right now. Up next, infection prevention and control. Now, I am not going to explain infection prevention and control because every nurse, from ENA to EN to PN to specialty, should be like this with the infection control, because there is no nurse without infection control. And if you remember, Florence Nightingale was one of the first people to actually identify infection control as being one of the biggest parts of nursing that need to be focused on, actually taught and deliberately instilled in us and made part of the day-to-day working ethic of nursing. So infection control is very important. That's why I'm like, I ain't going to explain that to you. Niazi, if you don't know, I don't know what you're doing in nursing, you need to go and look for something else to do, because infection IPC is with nursing. Okay, all right. Now, an IPC specialist is somebody who also in nursing, guys, is a scientific method. I don't know if you guys have noticed that nursing is a scientific method. Everything we do is based on scientific data collection, trend monitoring, identification of the trends, and then implementation of corrective measures, and then re-evaluation of whether the measures have been implemented correctly. Are they actually effective? Things like that. In nursing, guys, you don't, like I said in my previous videos, you don't just wake up and do nursing. You are trained to do the things and do the things the right way. Okay, right. So an IPC specialist monitors trends in infectious diseases, prevention of infectious diseases, monitors the implementation of protocols that have been put in place for infectious diseases, follows up on things like notification of infectious diseases. They do training programs for if a new or a recurring reoccurring infectious diseases now coming back into play, and the staff needs to be put back up to date, whether people are actually following hand washing, hand wrapping. Are there facilities available for hand wrapping and hand washing? Are people actually ordering the stock? Are they using the PPE? If they are using the PPE, are they using the PPE correctly? Yabona zonke lezo zinto umsebenzi mningi, guys, mningi umsebenzi. So that is what an infection control specialist does, or infection prevention control practitioner does. Now, bahola malini. Yay! Like I said, the highest salary that infection prevention control specialists get is 444,000 per annum. You can divide that and find out for yourself how much people get paid per month. Okay, 444,000. This is, this is according to e-pay scale, ne? And this is in rands. This is in rands. I'm not just getting these salaries out of the sky, guys. I'm researching and finding out for you. There's a whole laptop here next to me. Right here. See? A whole laptop where I am finding this information to show you ukuthi ayibo uya iyadliwa imali emnyango, but you must work for it. Shame. Nothing, you're not gonna get it for free. Not gonna get it for free. Right. Now, I did find a few places that offer this course, but there's only 3 places that I found. But I know there is more. IPC, you guys who are already in IPC, because I heard, hey, must have an IPC certificate. Where did you get the IPC certificate? Tell us. Don't be stingy with the information, people. Don't be stingy. Tell us where you got it from. Boy, just a little bit. There's the foundation. We've spoken about the Foundation for Professional Development before. They are a professional development institute that provides a professional development for people, obviously in a variety of professions. They do basic introduction into IPC. It's about 999. I don't know, they don't say whether it's 1 day, 2 days, what the thing is, but again, what I did see is that they have a quiz at the end of the session, so I think it's 1 day. I will be putting the link and see for yourself. And then there's also another institute, Courses for Success. It's self-paced, and you get a certificate of completion at the end. And right now it's going for 2,837, but its normal price is like 4,000. But it's like a 50% discount right now. Then the one that I am trying to do, but it's so expensive. It is the University of Free State. Now, guys, University of Free State is doing all the things for me right now. They are doing all the things for me right now. Hey, you know what? I will show you all later. What are these people doing? Actually, if I can get this up, I will show you all. University of Free State. They are for the people, by the people, to the people. Saying, but corner lock. Bona, they have a course. Air infection prevention and control. It's 5 contact sections online via Microsoft Teams, via Teams, and 7,700. Who has 7,700 just lying around? But anyway, God will provide. And obviously, they will have like their testing methods, whatever. But guys, please just go to the University of Free State's website. And there's this other thing, just Google short courses, University of Free State, or just say health or nursing, University of Free State. They have everything over there. yeah, so that's it for today. Today my video is like extra long, but it's worth it. It is so worth it because yay, you need to know the information in order for you to do what you really want to do and have the job that will satisfy you, yeah. So I will see you soon. Please do like, subscribe, and share this with your friends. And please don't forget, commentani langezansi. I'm gonna put in a link to all these websites, and just do the things. Tell us where you guys are, how you guys are getting these jobs, so that we can also get the jobs. Right. See you next time.
Please don't forget to like, subscribe, and share. See you next time.